you have to inspect your stool.
Sure.
Like, you have to look at it.
You
When you do that wipe,
Yes,
you have
should.
to look and see what has come out.
Yes.
And I think people were so surprised.
Yes.
But why should we observe our stool? And also, what are we looking for?
One of the functions of the colon is actually to produce mucus. It is when it is excessive that it is a problem. And the other thing, you can even see worms. When you have worm infestation, you can actually see worms in the stool. So those are the things that you look for.
Okay.
Yeah.
And how often should we deworm?
No, you shouldn't be deworming. If you're a healthy person who's not eating, who's not in a remote setup, you're not eating out of the house, you're not working in the remote setup, there's no room for deworming.
Really?
Yes, deworming is only for children. For adults, it's not necessary.
I've learned something new today.
Yes.
I think something else that you've also clarified is not all diarrhea is caused by a bacterial infection.
Yes,
and
in
you
fact,
find
majority of the bacteria of the diarrhea is not infectious.
Yes. Yeah, and many people run for
Antibiotics.
Flagyl.
Yes.
Metronidazole. You people have abused that metronidazole. Honestly, it's on its deathbed like this.
Yes.
Give it a rest. Put it down, okay?
Yes. I don't think it's good use of your money.
Yeah.
I think probiotics are only important in certain setups. Like maybe, for instance, during an episode of diarrhea.
Yeah.
All right. Patients who have underlying chronic conditions, like patients who have what you call connective tissue diseases. So they have gut problems that prevent them from absorbing things, and they have gut changes because of stasis, because the intestines don't move very well in that case. But for a normal person, healthy person, me and you, I think it's a better use of your money in other ways.
Or you can buy the yogurt.
You can buy the yogurt.
Okay.
Yeah.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough information to help you make an informed decision. So today on set, I have a guest. But before I introduce, I realize I haven't introduced myself. So my name is Dr. Hope for anyone who's coming here, and I am the host of this podcast. So I have a guest, and she's called Dr. Edna Kamau. Some of you may know her, but I'll let her to introduce herself.
All right. Thank you very much, Hope, for having me today. My name is Edna Kamau. I'm a gastroenterologist and a consultant physician. I've taught Hope, I think, in the University of Nairobi many years back, but now I'm in full-time private practice. I'm also a mother.
Okay.
I have 2 children, and I love to exercise. I think my go-to extra thing is running.
Okay.
So, that's me. Yeah.
What's your longest run?
Half marathon, 22.
Oh.
But on regular basis, I do about 10 kilometers. Like yesterday, I did 10. Today, maybe I'll do 10.
Wow.
That's how I say.
I'm trying to get to 10. I think I can do 3 without stopping.
Yes.
So I'm trying to get to 10.
Oh, good.
Yeah. Okay. But it's nice to have you here.
Thank you very much.
She's a busy woman. I can say she's a busy woman. But finally she's here.
Yeah.
And before we start, so I usually have a segment called A Journey to Inside Out.
Yeah.
So Inside Out is a movie.
Yeah.
I don't know if you've watched it or heard of it.
I've heard about it
Good,
from my
good,
children.
good. Mm-hmm.
Yes.
Okay.
Yeah.
So basically it talks about emotions and it kind of explains why we act the way we act. So I just want to find out right now, how are you feeling mentally, emotionally? Where are you at?
Okay. I think I'll think about it in 2 ways.
Okay.
On a personal level, I have joy.
Okay.
All right. I'm full and I'm balanced. But at a country level, I'm feeling very, sad this week. I think if I look at what has happened, it's a bit, do I say disgusting?
Yeah.
And ultimately sad to see the kind of decorum that our politicians are behaving with, and seeing how low we've come as a society saddens me.
Yeah.
And especially thinking about it in terms of next year we're having elections.
Yeah.
So it makes me wonder what kind of elections we'll have. But overall, thinking about how the society is behaving, especially in the healthcare space, of patients are suffering, and that people behave like everything is okay, and they have the right to talk the way they're talking.
Yeah.
It felt very bad to hear, the top government official say he's going to dedicate 1% of his time talking badly. I would have hoped he'd have dedicated 1% of his time talking about healthcare.
Yes.
And maybe cancer, and especially colon cancer, because this month is colon cancer
Awareness
So,
month. It's actually very embarrassing, by the way. Yeah. I think they need to do better.
Yeah.
And by the way, I'm looking at the camera. Kama uko kadi, this is the right time to register to vote, because honestly, it's your civic duty, but your one vote, it does count. So please don't ever think it doesn't count. Sawa sawa. So I think for me, I would say I'm relaxed a bit. Okay. I'm really enjoying the rain, so I'm happy about that. I'm sorry for people who are not enjoying it, but I'm happy about it. It's cool. It's not as hot as it was.
Oh, that's good.
Yeah. All right, so let's go to the doctor's seat.
Okay.
I have a few questions.
Sure.
Don't overthink them. Just answer them the way you would. It's not a lecture. Don't
All
think
right.
you're in class. Yeah.
All right.
So the doctor sits. The first question I have is, if you had to explain to a 4-year-old what you do in 1 or 2 sentences, how would you do it?
All right. I'm the doctor who treats anything from the mouth to the anus.
Oh,
Make sure you're happy as you eat and as
Yeah.
you poo.
okay.
Yeah.
Correct. Next question. If you were to rate your top 5 medical specialties, which ones would they be and why?
All right. Number 1 would be psychiatry.
Oh,
Yeah. And I think for me it's because maybe as I've gotten older in the profession, I've realized the impact of mental health
Yeah.
in overall health.
Yes.
Number 2 would be endocrinology. And that would be because I think the hormones are underrated. We are who we are because of the hormones, and we don't talk about it a lot.
Yeah.
The third one would be physical health. So people who do sports medicine,
Okay.
any sports injury puts you really, really down. And number 4 would be cosmetic surgery. And the reason I say that is we've always thought about it in terms of, it's bad.
Yeah.
But it's very, very good for patients in terms of mental health. The patients who are very different, they feel very different about themselves just
Yeah.
because something small has been corrected. Could be a small mole around the nose. And everyone has, maybe for a long time, they've always thought badly about it. Someone comes in and removes it, and they feel very, very good about it. And finally, it's urologist. If you've seen a woman who has, who smells of urine
Yeah.
and has had a fistula repaired, I think that's one of the most transformative surgeries.
Yeah.
Yeah.
And there are very few female
very few.
urologists.
Yeah.
Okay.
Yeah.
Then the next question, I think you like this one.
Yeah.
If you won a grant today, what
Yes.
problem are you solving?
I think for me to be very clear, I think one of the emerging problems in the country is GI malignancies, specifically colon cancer. I think it's easy to implement.
Yeah.
I think we can use very few resources. It's very easy to scale up. And it's one of the cancers that have been found that prevention makes a difference. If you look at the countries like in the US,
Yeah.
over the last 20 years, they've had a decline in overall rates of all colon cancer, primarily just from screening. Of course, they've had increase because of other parameters.
Yeah.
But colon cancer screening is one of the few successful stories in terms of cancer screening. So if I want a grant, I would roll out a program just to prevent colon cancer and early detection.
Okay.
Yeah.
Okay. The money is coming.
Hopefully, yeah.
Then the next question is, what's one skill or one habit that you think makes you a great doctor?
Listening. I'm a keen listener. Yeah, just allow people to talk. And I think the story is told by the patient.
Yeah.
They have the diagnosis. That's it.
Oh, they have the diagnosis. Yeah. That's true. Most doctors have said listening, so I think we're doing well there. Then the last question. So our episodes go up on Wednesdays.
Yes.
And we want to use a bit more of our local languages.
Yes.
So Swahili.
Yes.
So the question is, ukitumia lugha ya taifa,
Okay.
tueleze mada ya leo
Yeah.
na dalili moja ama mbili yake.
Okay. Kidogo hapo nimepotea. What is mada?
Topic. What's the topic of the day? And give us
Okay.
maybe like 1 or 2 symptoms.
All right. Mada ya leo ni kuhusu kuhara na magonjwa ya kuhara ni tofauti. Kuna ile kuhara ambayo imekuwa kwa muda mfupi na kuna ile kuhara ambayo imekuwa kwa muda mrefu na zinatofautiana na vile zinatibiwa.
Okay. Correct. Don't panic. Okay, so now we'll just go straight into the episode.
Good.
And I remember when I reached out to you to have this conversation, I initially had thought of a different topic, but you kind of suggested we start with diarrheal diseases so that it's more comprehensive.
Yeah.
So before we go there, you said you're a gastroenterologist.
Yes.
As a patient,
Yes.
when should I come to a gastroenterologist?
Okay. Anytime you have any digestive issues, so it could be anything like, your gut, you're bloated, you're having diarrhea, you're losing weight, and also for screening purposes. That's when you should see a gastroenterologist. Or if your liver has a problem,
Okay.
you notice you have yellowness of the eyes, or you do your annual medical checkups and you find you have abnormal liver test, that's when you see a gastroenterologist.
Okay.
Yeah.
So in case you didn't know, now you know.
Yeah.
All right. So now, diarrheal diseases. I think for me, something that I've been seeing on and off social media is people saying you always have to move with Imodium in hand.
Okay.
And in med school,
Yes.
of course, we're taught, first of all, let the diarrhea just come out, let it happen.
Yeah.
But we also get the term diarrhea wrong.
Yes.
So what is diarrhea from a medical standpoint? Because it's not just
Okay.
about the consistency of the
Yes.
stool, yeah?
Okay. So diarrhea is a change. We talk about diarrhea when you have a change in your stool consistency or your stool frequency. So everybody has their baseline, stool consistency. If you have an increase in your stool frequency, and a normal stool frequency can range from 3 times a day to up to 3 times a week. So if your baseline stool frequency changes, that's a diarrhea episode. So let's say Hope goes to the toilet every 3 days, but now she's going every day. That's diarrhea from that context.
Okay.
The other way we look at diarrhea is in terms of consistency. So we have a way we classify stool in terms of a structure, and traditionally we use something called a Bristol stool chart, which looks, if I think about in layman's language, it's, the normal stool should look like a sausage that is not cooked, all right, like a soft sausage.
Yeah.
If your stool looks more towards the watery or the mushy side, that lightness or looseness of the stool, that is diarrhea.
Okay.
Yeah.
Now that you brought in the Bristol chart,
Yeah.
I remember there's a time or there was a moment a while back when I was talking about stool, and it was, I think, around colon cancer awareness, and I was telling people, you have to inspect your stool.
True.
Like, you have to look at it.
You
When you do that wipe,
Yes, you
have to
should.
look and see what has come out.
Yes.
And I think people were so surprised.
Yes.
But why should we observe our stool? And also, what are we looking for?
Okay.
Yeah.
You need to observe your stool because, especially for blood, you shouldn't get blood in the stool. So every time you go to the bathroom, it doesn't have to be every day. You could do it even every other day or even once a week. You should check for blood. You're looking for visible blood. What you also can find on the stool is that you can get mucus on the stool. It is not unusual to get some spots of mucus because one of the functions of the colon is actually to produce mucus. It is when it is excessive that it is a problem. And the other thing, you can even see worms. When you have worm infestation, you can actually see worms in the stool. So those are the things that you look for.
Okay.
Yeah.
And how often should we deworm?
No, you shouldn't be deworming. If you're a healthy person who's not eating, who's not in a remote setup, you're not eating out of the house, you're not working in the remote setup, there's no room for deworming.
Really?
Yes, deworming is only for children. For adults, it's not necessary.
I've learned something new today.
Yes. So that's a myth. Everyone is like, I want to deworm. You don't have to deworm. It's not necessary. Yes.
Okay, so for children, how often should they
They
deworm?
should do it every 6 months.
Every 6 months.
Yes.
Okay.
Yeah.
Wow.
Yeah.
I keep on telling people to do. In fact, I just dewormed last
No,
week.
you shouldn't. There's no
Really?
room for that. Yes.
Okay, that's so
Yeah.
interesting.
There's no scientific basis.
Yeah.
Yeah.
Okay. Now you talked about when you're talking in Kiswahili, you said it can also depend on how long you're having the diarrhea.
Yeah.
So what do you mean by how long?
Okay. Let me give you an example.
Yeah.
So today you go out and you eat some Chinese food and you come back in the evening and you have diarrhea. That's likely to be something we call an acute diarrhea. That's likely a toxin that you've ingested. Maybe the rice was not very fresh, the chicken was not very fresh. And so your body produces toxins and you produce this profuse diarrhea that is very short. Within a day, you have bad diarrhea, lots of watery diarrhea. So when you have that kind of diarrhea, you don't have to worry about it because it's going to pass through by itself. Then you're going to have the second kind of diarrhea that lingers on for a period of time, what you call the acute diarrhea. And this is diarrhea that's lasting between 1 and 2 weeks.
Okay.
Most of the time, that diarrhea is usually from infections. And most of the times, infections would be either parasitic infections, bacterial infection, even viral infections. And the way we assess that, you're going to have to do some basic tests. Then you have a second category, which is what we call subacute diarrhea. This is diarrhea that's lasting between 2 weeks and 4 weeks. And that falls in between different causes that maybe we'll discuss as we go on.
Yeah.
Then there's diarrhea that lasts more than 4 weeks. Now, the diarrhea that lasts more than 4 weeks is called chronic diarrhea. And that is where a lot of investigation needs to come in because you find there are people who have diarrhea every single day for years and they've not been investigated.
Yeah.
And the causes of that are also a lot. They're plethora of them. Yeah.
Okay. So now if I'm to have, let's say, diarrhea today.
Yes.
Let me not say diarrhea. If I'm to have a loose motion today, maybe I ate something bad, like the rice that you talked about.
Yeah.
how many episodes should I have for me to either go to hospital or for me to be like, okay, fine, this is a bit serious?
Okay. The number of the motions does not matter. It's
Okay.
the associated symptoms that matter.
Okay.
All right. So if you have acute diarrhea and it's profuse and you start to feel weak, all right, you're starting to get lethargic. So it means that you're starting to lose electrolytes in your body. So you're starting to lose fluids in your body. So you're starting to get dehydrated.
Yeah.
So you have to go to the hospital to be evaluated because you're probably getting dehydrated. If you have acute diarrhea, you have an episode of diarrhea but there's blood, we call that dysentery. Then again, that is a cause of concern because that means there's inflammation in the colon, and then you should again be evaluated.
Okay.
Then there's diarrhea that will be, then you have the underlying reasons. For instance, you are diabetic.
Yeah.
You have underlying conditions. You have a cancer, maybe some other heart problem, and then you have this profuse diarrhea. Then in that case, it has to be taken more seriously because your body reserve is not as good.
Yeah.
You cannot tolerate episodes of diarrhea like somebody who has a good reserve.
Okay.
So it's really a combination of factors. So your one acute diarrhea for a healthy person, even if you had 20 diarrheas,
Yeah.
you don't have to worry. And that's where Imodium comes in. You don't have to suffer.
Okay.
If there is no blood in that stool, it's just watery diarrhea, your Imodium works very well.
Okay.
And you can take, actually you should just take it immediately. Yeah. And then the other episodes where you'll have diarrhea in certain contexts that you've traveled, especially if you're traveling to areas that are not very hygienic. Let's say
Yeah.
you've traveled within Africa, within Kenya,
Yeah.
even to the Asian countries. A lot of us like going to Bali and wherever for
Yeah,
holiday.
Bali.
You get diarrhea in Asia, all right? That's mostly
Yeah.
a traveler's diarrhea.
Yes.
It is something that you've ingested. It's probably the water that you have consumed. That is fine. Within a day, even if it's 20, 30 episodes, as long as it's not more than 3 days, you don't have to worry. You can take your Imodium. It is when it lingers more than 3 days that then you begin to get worried.
Okay.
And in that case, if you can even get an over-the-counter medication to use before you evaluated, because most of
Okay.
the tests that we're going to do are not going to find anything.
Okay.
So you don't have to panic.
Okay.
But if you have the other symptoms, as I said, you're starting to get lethargic, you're feeling weak, you have underlying heart problems, then in that case, you should be evaluated faster. You should have at least go to the doctor, look at your vital parameters, make sure your blood pressures are okay. They look at your kidneys, they look at your salts,
Yeah.
and then they can be replenished if there's a problem. And there are home remedies that you can even use for that. You can just take your normal salt and water
Yeah.
and sugar even before you go to the hospital if it's your child, and give them that fluid even before you take them to the hospital.
Yeah.
Yeah.
Or the ORS.
The worst.
Okay, okay. Now you've mentioned multiple causes. What are
Yes.
some of the common ones that we see, the common causes of diarrhea? Yeah.
Okay. The biggest cause of diarrhea is most of the time is non-infectious and mostly food poisoning. That is for acute diarrhea. And acute diarrhea from food poisoning, as I said, most of the times it's food you've ingested. Most of the times it's a rice product, is a chicken products, especially meat products,
Yeah.
which are not well preserved. It might not be that they're bad, but they're not preserved very well.
Yeah.
For instance, rice that has stayed in the fridge for a couple of days gets spoiled very fast, or if the temperature is not correct, you get a lot of electrical outages in Kenya, power outages. If there's a power outage and you had rice in the fridge, you need to be worried about it because it could give you food poisoning. So if you could consume it as fast as possible, it's very important. If you have to reheat it, you reheat it very, very fast.
Yeah.
Because what happens with those food, they produce toxins, and what those toxins do, they allow you to secrete a lot of water in your colon, and that's how you get the diarrhea.
Okay.
All right. Then there are infective diarrheas. That means you've consumed something with a bug. Let me give you an example of something like chicken. Then you have something called Campylobacter, all right, which is a bacterial infection in that stool. If a bacterial infection in the chicken,
Yeah.
so you consume a chicken that is infected because it wasn't stored very well, all right, you then have diarrhea. And this
Yeah.
is very common in parties. Fish, chicken, very common to get diarrhea episode. Then there are viral diarrheas. Just like the way you get a viral infection like a flu, there are viruses that can infect the GI system. That's why you see children being vaccinated for rotavirus, and they again present with a lot of diarrheal episodes. Then we have medications that can actually cause diarrhea. So some of the side effects of medicines are diarrhea. So some patients will come and tell them, I'm having diarrhea, but it's because they're taking a laxative. So they forgot, they started from constipation, and now they're having diarrhea. So you always have to inquire.
Yeah.
And then some of the medicines, the way they work also causes diarrhea. So you'll find some of the medicines that you use for maybe antacids, they cause diarrhea as a side effect. Some of the antibiotics, Very,
Yes.
very, very common. So you had a pneumonia, you're given an antibiotic, you have diarrhea.
Yeah.
It's a side effect of the antibiotic. So that we find sometimes you're given some probiotics to help counter that effect. And even taking an Imodium, which is an it reduces the motility of the gut, the movement of the gut, so you stop having the diarrhea. Is another episode. Then, and that is the biggest bunch of patients who have acute diarrhea.
Yeah.
It's usually from that category, viral, food poisonings, Then we have patients who get diarrhea in other contexts. For instance, patients who have underlying conditions, like a heart patient. You reduce their blood supply because they're very sick. They get some ischemia or a reduction of the blood supply to a certain section of their gut, and they present with diarrhea.
Wow.
All right. Then we have patients who are old, and they also have aging of their colon. So we get something we call diverticulosis. And those are pouches in the colon. Sometimes they get infected and they present with diarrhea. So it depends on the age and the context of the person. Then we have the chronic diarrheas. Now, the chronic diarrhea, that's a different story.
Yeah.
And that's what maybe you're going to be discussing the next episode. We have what you call inflammatory bowel disease. We have irritable bowel disease. And we have medications as some of the overriding factors. And there's some other small parameters like what you call microscopic colitis.
Okay.
Yeah.
I've just remembered one. I don't know where this one falls.
Yeah.
Now, lactose intolerance.
Okay. So lactose intolerance is one of the causes of malabsorption. So that falls in the chronic category.
Okay.
So lactose intolerance is a malabsorption. So if you don't absorb a product, you take milk, the main product is lactase. All right. If your body cannot absorb lactose because you don't have enough lactase enzyme, it will be in the small intestine. You'll draw in water and you'll have diarrhea. Same with gluten. So if you take wheat products, the main component in wheat product is gluten. If you cannot absorb gluten, your body will not absorb it, so it will not be broken down. So it will stay in the small intestine. You'll draw in water and you'll have diarrhea. And you can have intolerances to different things. Yeah.
Okay. So the people who are lactose intolerant, now that's why.
Yes.
She's just explained why.
And then there are also malabsorption because you lack certain enzymes in your body. For instance, if your pancreas is not working very well, you've been a chronic alcoholic, you've damaged your pancreas, or you have a problem with your pancreas, so you don't have enough enzymes to absorb, to digest, so you get a malabsorptive diarrhea. And the way they present is different. You'll have it maybe as watery or as fatty because of that. Or you have a cholecystectomy, your gallbladder was removed. Then you have this bile that's a lot, so you get what you call bile salt diarrhea because of excessive bile. But those are more chronic causes, and we evaluate them in a bit of a more complex way. So it's not the simple stool test that you go and do. It's not the simple Imodium. It will be good for relieving the symptoms, but to get to the underlying reason and to treat, you have to know what the cause is.
Okay. I think you've answered a question of mine that I had, because I think in med school, and I think the syllabus needs to catch up.
Yes.
Because we were told that, or rather we were taught that when it comes to diarrhea, the first thing is to let it pass. Like your first step shouldn't be take Imodium. Let it pass so that you can eliminate the toxin or whatever it is. And then if it's persisting, then now that's when you start thinking about medication. So I think you've elaborated on that.
But that has a truth in it because most of the diarrhea passes through. But you say the Imodium is a quality of your life. It's your quality. You don't have to have going to the bathroom this many times. So if there's no risk of having something we call pseudocolon, a megacolon, so you're not worried. That's why don't take the Imodium if you're having blood in the stool.
Yeah. Please look at the camera as you're seeing that one. It's very important.
So if you're having blood in the stool, you must visit the doctor ASAP.
Okay. Then I think something else that you've also clarified is not all diarrhea is caused by a bacterial infection.
Yes,
and
in fact, majority of the bacteria of the diarrhea is not infectious.
Yes. Yeah, and many people run for
antibiotics.
Metronidazole. You people have abused that metronidazole. Honestly, it's on its deathbed like this. Give it a rest. Put it down. Okay. Sawa. Now let's talk about investigations. I know we talked about stool tests. So what stool tests do we have? Out there.
All right. So the first evaluation you do would be a stool test. And what you're looking for in the stool is a basic microscopy that tells you whether you have abnormal cells in the stool. So when you do a microscopy, you look at how does the stool look like. So they start by analyzing the gross appearance, how the stool look like. Does it look watery? Does it have blood that they can see? Is there mucus in that stool? All right. So already if you have blood and mucus, then this is a dysentery. All right. Then you look at, are there abnormal cells in it? Are we having pus cells? And what is the quantity of the pus cells? Are there red blood cells that they can actually see under the microscope? Then they'll be able to see ova, which are eggs, and certain parasites, in the stool, and that is what is reported. Then you can go on and do a further analysis on that stool, and you can do what we call a stool culture, whereby you take that stool sample and culture it or grow it for a couple of days. And when you have that culture, you're able to pick out the bacteria that is bringing the problem, and you can be able to even do sensitivity studies where you're able to select the antibiotic that will most likely respond to the cause of the infections. We have what we call a biofilm. A biofilm is like a DNA test. It's like a profile that has many antigens that they look at. It's a bit costly, but for patients who have this subacute diarrhea between 2 and 4 weeks, that's one of the tests that we do. It's able to analyze for you a lot of the infections that is there. You can get that in many of the major hospitals that you will see. So that's a basic test for the stool, and that is a bit. If you do a stool test within 30 minutes, in most good labs, you'll have the results. But you have to be sure that the quality of the lab is good, because this is where the problem comes in.
Okay.
And the interpretation of the results. So if you go to a lab technician who's not well informed, they will not get the parasites that they need to see. They'll not see the ova that they're meant to see. The other thing that the stool can pick, they might pick things that are not actually responsible for your current diarrhea. An example is amoeba. If you're getting amoeba, what causes you to have acute diarrhea is something called trophozoites. Trophozoites. That is what will show that you have an acute diarrhea. The cause of your acute diarrhea is the amoeba. If you have cysts, it just means you can infect someone else.
Okay.
You get? So you find many times patients take flagyl because they're having cysts in their stool rather than trophozoites. So you have to make sure that, again, once you get the result, don't interpret it for yourself. Take it to a doctor. Sometimes we get fungal infections. We can get cysts on the stool, and that would mean maybe getting an antifungal rather than antibacteria for your food. And they can also see undigested food, so they'll be able to see, they can be able to see starch granules, which means maybe just a bit of malabsorption on the stool. Then you can move on to the blood test. So if you do a blood count for a patient who's having diarrhea, you're looking to see certain things that tell you, is it something that is worrisome, what you call alarm symptoms, and even also sometimes the cause. Let's say if you have a bacterial infection as a cause of the diarrhea, you have acute dysentery, you'll have an elevation or a reduction of your white blood cell counts because your body reacts in certain ways. So you increase the white blood cells beyond a certain level, or you drop them. All right. And the kind of pattern of white blood cell change will also reflect the type. So if it's a bacterial infection, you'll have what we call neutrophils, and if you have a viral infection, you have more of the lymphocytes.
Okay.
All right. Then the other parameter we look at is your hemoglobin levels. So what is your hemoglobin level? If you came and saw me today with an acute diarrhea, you expect that your blood counts will be fine. Your hemoglobin level, you will not have an iron deficiency anemia. Your blood levels will not be low. So if you're low and you're presenting with a diarrhea, then the question is there something else that's going on? Then the doctor has to investigate. You could have presented with a diarrhea, but maybe there's a colon cancer somewhere in the background or some polyp somewhere that needs to be checked, even after this acute episode of the diarrhea. Sometimes you'll find the platelets, which is the one that fights, your clotting mechanism is high. You're having a bleeding, you might find the platelets going up. Then you go to your chemicals in the body, what you call the biochemistry tests. We do what you call a kidney test, and in that we're looking at your creatinine. How is your body reacting to this diarrhea? Are you losing too much blood that your kidney is beginning to shrink in terms of how it's working? You have an increase of the creatinine. This is key in people who are elderly people. People who are more than 70 years old don't tolerate diarrhea very well. Patients who have underlying problems like heart problems, who have kidney problems, don't tolerate very well. So an increase of your kidney levels could indicate an acute injury to the kidney because of the loss of fluids, because of the diarrhea. So you have to rehydrate that patient, stop the diarrhea for their kidneys to recover. And if it is something just because of a diarrhea, if you repeat that test maybe in a couple of days, it corrects itself. Then there are certain chemicals in the body that you lose as you're having diarrhea. We have what you call sodium and potassium. If you do your test, you'll notice those parameters change. And that is where the rehydration choice of fluid comes in, or what we give at home. So when you're giving our oral fluid, our salt, and my mother's giving us salt and
sugar.
They are very sharp because what they're doing there, they're actually giving you sodium and chloride. They're bringing back your sodium levels high, so your energy levels go up. That's why you find you're very dehydrated, and we say just drink a lot of water. Drink a lot of water, salty water. That salt is key, and the sugar is key. It's balancing it out. It's bringing the sodium up so that your energy levels go up. Then we have other tests that we can do to look at the causes. And these are things like thyroid functions. I know thyroid diseases are very important in terms of diarrhea. So patients who have chronic diarrhea sometimes have it because of thyroid diseases. Yeah.
It's actually good you brought up thyroid because we've talked about thyroid in the past and how it's such a small organ
Very
that can
important.
just cause so much havoc.
Very small. Yes. That's why I said, remember I said endocrine? Very important.
Endocrine,
Yes,
and especially for women. If women, please make sure your hormones are in check because it can cause a lot of dysfunction in your body.
An imbalance is
An
not
imbalance, you've mentioned elderly people and how diarrhea can really contribute to dehydration and their kidney function. Also kids.
Yes, and kids or young
kids.
And kids,
And something else that I think we tend to forget, sometimes diarrhea manifests with vomiting at the same time.
Yes.
So that's a double whammy because if you're losing water from your vomit and also from your diarrhea, dehydration sets in very fast. So rehydration is very, very important. Okay, now let's go to management.
Okay.
So we've talked about Imodium, yes. But how do we, from a clinical perspective, manage diarrhea effectively?
Okay. I think the first thing starts from home. You know, first episode of diarrhea, take a lot of fluids. Rehydrate, avoid things that are going to exacerbate the diarrhea. So you're not having diarrhea and then you're eating your fatty foods, which is most likely going to exacerbate the diarrhea. Okay. If you're having an enteritis or acute gastroenteritis, like what you're suggesting, someone is vomiting, you want to give them food that are less nauseous because they're likely to continue vomiting and it's going to worsen their dehydration. Then Imodium comes in, which is an anti-diarrheal medication, which what it does is stops the movement of the colon. So that is good, especially in a travel setup.
Yeah.
And I think that's where people have it in their handbag.
Yeah.
I think it is perfect.
Let me tell you, me, I'm always ready. Especially in the car, I have an extra set of clothes.
Yes.
Just because you never know when the diarrhea will strike.
Yes.
I have Imodium at hand.
Yes.
Always.
Yeah. That's not a bad idea for if you're an avid traveler. I think that's a good idea. Or you eat out
but
a
not
lot.
even avid. Imagine you're sitting in traffic and then you're just like, oh, I can
feel like going to the toilet.
coming.
Yes.
Yeah. So you just need to have that extra security. Yeah.
That's a good idea. So you can have that the Imodium to take. Then when you go to, depending on what we find as a cause.
Yes.
If the diarrhea is acute, most of the time a single tablet of an antibiotic is effective. The most we go is 3 days of antibiotics. They're super effective. Then we rehydrate the patient, and the choice of rehydration will depend on how dehydrated the person is. So if you're not very dehydrated, we can give you orally. So we give you a liquid to drink, and you can compose that at home. But if you're very dehydrated, you might have to get fluid either in casualty or get admitted, because then we have to make sure that your body rejuvenates to where it is, and we correct any abnormal parameters. Then the specific cause will depend. If you have a viral diarrhea, you don't need antibiotics. It will go away by itself. Remember, the viruses do not require treatment. That is just supportive care. If you're having cramps, then you'll need maybe some antispasmodics. If you're having a fever, then you can get an parasitic or antipyretic medication. Then the cause, if you're having a bacterial infection, the specific likely cause, which most of the time is determined as where the source was. Like say you had traveled. So there are certain and things that we consider when you've traveled. We'll give you antibiotics tailored towards that, If it's parasitic, then you get an antiparasitic for that. Then the chronic diarrhea, that's a little different. So once you identify the cause of the diarrhea, let's say we have irritable bowel syndrome. When you have irritable bowel syndrome, the first thing we look at your dietary discretions and see what are the things that you might be taking that are making you have this diarrhea. That's where things like lactose intolerance come in, and avoidance of lactose intolerance, of lactose products or dairy products. If it is gluten, which is the main component in wheat products, then we get you out of the wheat of the gluten. So avoiding those products, and then even in that setup, there's role for using anti-diarrheal medication, because maybe you can't avoid certain things. Then you might have to use anti-diarrheals at that point. Then the patient will have inflammatory bowel disease. If you have inflammatory bowel disease, which is now made, at that point you'll have gotten to a gastroenterologist, then the treatment will be based on the type and the severity and the extent of the disease. And then there are probiotics.
I was going to ask that.
Then there are probiotics. As you have diarrhea, you lose your good bacteria. So the digestive system is very rich in terms of flora. You have very small bacteria there, which are very important for digestion, which are very important for absorption, and for your overall good health. So when you have diarrhea, you have a depletion of those products. So when you have diarrhea, we replenish you with a good bacteria. So you'll find that we'll give you probiotics for a couple of days, most up to 2 weeks.
Up to 2 weeks. Are there dietary sources of probiotics?
I think there are dietary. I've seen a lot of yogurts which have been infused with probiotics. Yeah, I don't know about natural products, but there are products which have been enriched with probiotics. Maybe I can say a disclaimer. You don't need probiotics on a daily basis. I don't think it's good use of your money. I think probiotics are only important in certain setups. Like maybe, for instance, during an episode of diarrhea. All right? Patients who have underlying chronic conditions, like patients who have what you call connective tissue diseases. So they have gut problems that prevent them from absorbing things, and they have gut changes because of stasis, because the intestines don't move very well in that case. But for a normal person, healthy person, me and you, I think it's a better use of your money in other ways.
Or you can buy the yogurt.
You can buy the yogurt.
Okay.
Yeah.
Then I think I had another question around now the infectious causes. Are there vaccines that we can not use but get to prevent us from getting some of these diarrheal diseases, the infectious ones?
Excellent question. Actually, they are. You can actually get vaccines as you travel. So vaccines are usually for prevention purposes, and there are different vaccines, and they last for different period of time. Let's say you're going to work in an endemic in maybe Southern Sudan, which is war-torn, and you're not going to be in control of your water. So you're likely to get maybe cholera. So you can actually be able to get a cholera vaccine before. All right. So there are vaccines that you can get as you travel towards that. And the patients we give vaccines because they have underlying problems, because they cannot tolerate any destabilization of their normal rhythms. So patients maybe who have chronic liver disease, you might want to vaccinate them for hepatitis A, because you don't want them to get hepatitis A diarrhea. And you also don't want to get them to get hepatitis A in the liver. So in that case, you'll get the benefits in terms of the liver and in terms of the diarrhea. But cholera is one of the commonest. And there are also typhoid vaccines.
Yes, typhoid. I remember in med school, I had a patient who had typhoid, and it was so severe.
Yes.
I couldn't imagine typhoid could do that. So now when I see the typhoid vaccine, I'm like, guys, please just get these vaccines. They're actually preventative, so you won't end up getting these infections.
You just need to consult travel experts, and they can be able to advise you on which one you need based on where you're going.
Do we have travel experts in this country?
Oh, yes, we do. We have travel experts, people who have infectious disease, who have specialized in travel medicine.
Okay. Sawa.
Yeah.
I think I need to speak to some of them just to see.
You need to. Yes.
All right. I think we've exhausted at least just for diarrheal diseases. But now, before we wrap up, so now we did the doctor's seat. Now we'll go beyond the clinic.
Okay.
So just a few questions as well. Don't overthink them.
I won't overthink them. Yes.
So the first question is, if you had to text a simple health tip to all your patients right now, what would it be?
Wow. All right. This is, I'll go back to colon cancer. This is March. So I would tell anyone who's more than 45, please do a stool test, check for blood. It's 500 shillings. It's called a fecal immunochemical test. If it is positive, let's go on and check what's going on. Let's do a colonoscopy.
Okay. Correct. Next question. What's the first thing or the last thing you do for yourself, either in the morning or in the evening, that's just for your sanity?
Wow. Okay. As I said, I'm an exercise person. So the first thing or the last thing I do will be exercise.
Really?
Oh, yeah. I exercise at night because I'm very busy.
Okay.
So I run in the evening.
Really?
Yes.
And what do you do in the morning?
What do I do in the morning?
Yeah.
Honestly, I have no routine. I'm usually very late. So I just wake up and I run.
Usually very late.
I'm thinking about slowing down and think maybe I should wake up and read a book. I don't read, meditate. Maybe it will calm me down. I don't know.
Something that I think I really want to do. So I went for a workshop the other day, and you see the notebooks you're given all the time. So in the front page, it had a crossword, and then the last page had some mental stimulating activity. And I just these are some interesting things you can get. Maybe just a book that you do your crosswords or
it's interesting. Sudoku. I actually bought 3 Sudoku books which I've been trying to fill. That was what I bought in January. I haven't managed to finish, but I'm actually actively doing Sudoku for mental health. Help slow down dementia. And I'm in level 3.
Okay.
It's
level
interesting.
3. I think I was at level 1.
Yes.
Okay. Then the next question is there a moment you've ever felt like the body is so wild for doing that? Like, why would the body do that?
Maybe I can. Okay. Maybe I've overthought that one. Maybe you can repeat it. I think I've overthought it.
Is there a moment you've ever felt like the body has just shocked you. Like,
Yes.
why would it do that? Like,
Yeah.
this doesn't feel natural or normal. It's just weird.
Yes.
Yeah.
I think for me, I'll tell you, it's in patients who have had dual cancers. And I've felt it's not fair.
Yeah.
You know, a patient comes in and they have a pancreatic cancer and they have a hepatocellular cancer because of hepatitis B, and they're not linked. I just feel, no, that's not right. How can the body do that?
Yeah.
And in a 45-year-old, it happened to me last week. How?
Yeah.
That's so unfair.
Actually,
You know?
yeah.
Yeah. It shocked me.
Okay.
Yes.
I feel like cancer in general. I'm just like, why?
Yeah. Yes.
Like, just stay the way you are. Why are you now mutating to be something different?
Precisely.
Yeah.
Yes.
Okay, that's a good one. Then the next question is, what's a piece of health advice that you either used to give or you were given that you don't necessarily agree with anymore?
I think what I don't agree with mostly is we are what we eat. I think there are people who eat so well and they get the worst diseases, but who eat so well and they are obese.
Yeah.
I think there's a lot of genetic underlying factors that are very important, and we don't realize that. There's a lot of genetic. The people who are have good health and they do nothing about it. We see people who drink alcohol to the hills
And smoke.
Yes. And when you do their test, they're good to the T, and you're like, yes.
Actually, I've just mentioned
So I've
smoking.
come to that point of I eat.
Yeah.
I want to eat, not badly. Maybe I compensate with exercise, but I'm like, live your life. That's one of the things I'm starting to tell patients as we go on. Don't enjoy every moment as you live.
Okay.
Don't overthink it.
Yeah.
In gastro, sometimes what happens, you get patients who are very cautious. Oh, I only eat this, I only this. Like, you know what, you're going to live now.
Yeah.
So don't overthink it. Live the moment.
Exactly. With moderation, of course.
With moderation,
but live the moment.
Yeah.
Now, when you talked about alcohol and I mentioned smoking, I've just remembered something.
Yes.
And was it today? No. Yesterday, which was March 20th, was World Oral Health Day.
Oh, nice.
And I saw this, it's a recent statistic that smoking and vaping are now not the leading cause of oropharyngeal cancers.
Oh, really? Yes.
It's HPV.
Oh.
So now a question to you, because you said you deal with from the mouth to the anus.
Yes.
Is HPV something, especially oral HPV, is that something you're seeing more frequently?
No. Okay. Honestly, I've not seen that, but I've seen that in the setting of MSMs, men who have sex with men.
Okay.
And men who have sex with men should actually be screened for human papillomavirus. They should be vaccinated. They should have annual screening in the anus for human papillomavirus. So I've seen it on the opposite side.
Okay. Question. Is there a screening test for HPV for men?
No, but that's why it's in segregated patients who are men who have sex with men.
Okay.
Yeah.
Okay, yeah. But yeah, guys, please protect yourselves. HPV is out there.
And protect yourself.
Yes.
If you are that, please protect yourself.
I saw that now they're like oral condoms.
Yes.
And I'm just like, hey, we are there. Anyway, that's a topic for another day.
Yes.
So last question. What's a health rule that you think we should break every now and then without feeling guilty? I think you've said live a little, but is there any other that you feel that you should break? Yeah.
Overindulge. Treat yourself well. Be happy. The mind feeds the gut. A happy mind, a happy gut.
Oh, that's a good one.
Yeah.
Okay. So I think we've reached the end. And maybe before we let you plug yourself, where people can find you, is there something you would like the next guest on the podcast to talk about? Is there something you'd like us to talk about on this podcast?
Okay, probably we could move on to inflammatory bowel disease and irritable bowel disease syndrome.
Okay.
It's a big problem in this country. It's over investigated, over treated, not well understood. Yeah, I think that would be my next
Okay.
That should be a next topic.
Sawa. Yeah. So now over to you.
Yes.
Where can we find you?
Okay. Thank you, Hope. I'm actually based at the 40 Suits.
Okay.
I'm there. I run a practice there. I do my procedures, my inpatient work at Nairobi Hospital, but 40 Suits, 7th floor. You'll always get me there.
Sawa. We'll put your details and your information down here and in the description box.
Yes, thank you.
All right. Thank you, Doc, for coming.
Thank you very much. Thank you for having me.
Yeah, this was nice. I've learned a lot, actually.
Really?
But guys, if you've reached here, thank you so much for tuning in. Hey, drop another one. No, thank you so much for tuning in. And please follow us on our social media. My name is Dr. Hope. My handles will be down here. And our pages are Dose of Health, the podcast. Subscribe, follow. And that's a wrap.